Hello, I'm Kirsten Langley. I'll be performing a head-to-toe assessment today. I have already washed my hands and assessed the patient's vital signs, which are within normal limits. Can you tell me your name today?
Chloe Pilgrim,
And can you tell me your date of birth?
11/29/01,
And where are we today?
Jonesboro, Arkansas.
Okay, and can you tell me what year it is?
2016.
Okay, so I'm going to start with looking at your hands and assessing your skin. I'm going to pull up your sleeves. I'm just assessing. Tell me if you have any tenderness. The skin is warm to touch. There's no lesions, no striae, nothing abnormal. Her cap refill is less than 3 seconds on both hands. Her skin looks normal. I'm going to look at her head. Her head is normal cephalic. I'm going to feel your scalp, so tell me if you have any tenderness. Any tenderness there?
Nope.
Okay, her hair is fine. It's thick. It's straight. There's no evidence of any lesions or any kind of abnormalities on the scalp or the hair. So now I'm going to assess your lymph nodes. The first one is your occipital, so just let me know if you have any tenderness as I palpate. Okay, and now I'm going to assess the posterior auricular, which is behind the ear. And I'm going to assess the preauricular. And now I'm going to assess the tonsillar and the submandibular and also the submental. Okay, now I'm going to move on and I'm going to assess your superficial cervical and your posterior cervical. And the next one is your deep cervical, which I'm going to do one at a time. And I do feel the deep cervical, but they're not swollen. They feel normal to palpation. And then last one is the supraclavicular. And all are normal. There's no evidence of swelling or anything like that. Next thing I'm going to assess are your eyes. Just look straight ahead at me. And I'm going to shine a pen light. Assess your pupils. They're round and reactive to light. Her eyes are inline, midline. They're in line with the top of her eyes. I'm going to look down at your sclera. The sclera is pink. The eye's white. There's no swelling or any kind of painfulness. The eyebrows are equal and distributed. I'm going to look at her ears. I'm going to palpate and you just tell me if anything's tender in your ear. Have any tenderness?
Nope.
Okay, the ears are normal. There's no evidence of any kind of swelling. Small amount of cerumen present. I'm going to check this ear as well. Okay. Okay, I'm going to look at your nose. Your nose is midline and your septum is midline. I'm going to look inside your nose. And it is pink and moist. No redness, no evidence of lesions or anything abnormal. Her lips are midline. There's no evidence of cracking. They're moist and pink. Can you open your mouth for me? Say ah.
Ah.
Okay, her tonsils are present. Her teeth are all present. Her mucosa is pink and white. The tongue is normal, no swelling present. Okay. Now I'm going to feel your spine. I'm just checking to make sure it's midline. There's nothing abnormal. Okay. Can you take a deep breath for me? Okay. I'm going to listen to your lungs. Deep breath. Okay, I'm going to listen to your heart. Lungs are clear bilaterally, normal breath sounds, no adventitious breath sounds, normal S1, S2 on the cardiovascular assessment, no abnormalities, everything looked normal. Right now I would inspect her abdomen, which I'm not going to do for the video. I've already assessed her abdomen prior to the video. There's no evidence of striae lesions. Her umbilicus is midline. It's inverted. She has no other abnormalities upon inspection. So now I'm just going to listen to all 4 quadrants of her abdomen. Okay, bowel sounds are active in all 4 quadrants. I'm going to palpate each quadrant and you tell me if you have any tenderness. So if I were to feel anything in this quadrant, I would feel the liver if it was swollen. And then on the left upper quadrant, I could possibly feel the spleen if it happened to be swollen. In the right lower, you could possibly feel the appendix if it was swollen. And then on the lower left quadrant is the descending colon. And no abnormalities. I didn't feel anything upon palpation of any of the 4 quadrants. The patient had no tenderness with palpation of the abdomen. Okay. Now I'm going to assess the peripheral vascular, so I'm just going to feel pulses. Check your radial pulses. 2+ equal and strong bilateral. Okay. Pull your sleeves up a little farther and feel your brachial pulses. Okay, the brachial pulses are equal and strong bilaterally. Okay, I'm going to feel your feet. Okay. The posterior tibial are strong and equal bilaterally as well. Now I'm going to feel for the dorsalis pedis. And they are strong and equal bilaterally as well. Okay, I'm going to check your calf refill on your toes, which is also less than 3 seconds. I'm assessing your skin, no striae, nothing abnormal on the legs. Palpate, let me know if you have any tenderness. And no tenderness, no abnormalities with peripheral vascular. I believe I've assessed everything. Thank you for watching my health assessment video.